I'm Dr. Renata Wix-Harris, and I'm a cosmetic physician at Reflection Center in Martinsville, New Jersey. And today I'm going to talk about microneedling treatments. There's a difference between the ones that physicians can do and the ones that are being offered by nurses or estheticians, and they're not all the same, and we want consumers to be aware of what the difference is between these treatments and what the results will be. The first thing you need to know is that RF microneedling is not the same as regular microneedling or dermapen style microneedling. RF microneedling, which stands for radiofrequency microneedling, can only be performed by medical professionals, so you won't find it at a spa, and that's because the RF that's being emitted is pretty powerful. The impact can be similar to a laser depending on how strong the treatment is that we do, so we really recommend that that's being done by physicians to be safe. In this video, I'm going to focus on regular microneedling, but there will be a link below to a video about RF microneedling that we mainly use for acne scars or skin tightening. Microneedling devices can be set to different depths, and here in New Jersey, certain depths are considered out of scope for certain providers, which means that the medical boards have decided that only certain depths are safe to be done by people with certain medical degrees. So estheticians can microneedle up to a depth of 1 millimeter. Registered nurses can microneedle up to a depth of 2 millimeters. And physicians and advanced registered nurse practitioners can microneedle up to a depth of 4 millimeters. So why does this matter? This matters because the part of the skin that you're trying to affect changes in live at different depths. Like, for example, the collagen bundles tend to live at the deeper part of the skin that's deeper than 1 millimeter or 2 millimeters. Acne scars a lot of times are also much deeper than 2 millimeters. So if you're trying to improve, firming up the skin or affecting acne scars for depths less than 2 millimeters, you're usually not going to see a big effect. Also, many spas and estheticians oversell and overpromise what microneedling can do. No microneedling is very good at removing pigment. Lasers are much better at this and much safer for every skin type. So what is microneedling really good at, and what do we use it for in our office? One of the first places I use it is for stretch marks. It works really good for that, especially if you combine it with PRP or exosomes, which is a new way of improving skin quality. It usually requires a series of treatments, anywhere between 3 to 6. Now, it only works for the faded stretch marks, the ones that have no pigment in it. If they're red or purple, we use a laser to reduce the color out of it first before we move on to texture treatments. We also use it in our hair treatments. When we treat people with either PRP or PRP and ECM, we do the microneedling at the end of the treatment to stimulate the release of growth factors by the platelets. I also feel that it's a good treatment for people who have just very mild fine lines and wrinkles and want some improvement of their texture. So we don't think that regular microneedling works well for skin tightening or deep wrinkle removal or to even out the skin and remove brown spots.